Sunflower, dial 0.
Okay.
November 14th was Operating Room Nurse Day in the state of Hawaii, a day set aside to inform the public that the nurses in the operating room are people who are not only highly skilled, but people who care. So we decided to follow head operating room nurse Julie Rosner on one of her typical rounds.
Hi, Angie.
Hi.
My name is Julie Rosner. I'm a nurse up in the operating room, and I'd just like to ask you a few questions about your surgery.
The purpose of Operating Room Nurse Day is to inform the public or the healthcare consumer what an OR nurse does. First of all, we assess each patient's needs and determine the nursing care necessary for that patient throughout his surgical procedure. And we actually teach the patients what will happen during the surgery. That helps alleviate fears, and it's true, if you know what's going to happen, you can meet it a lot better.
And for the patient who enters the hospital for a short-stay surgery, they can expect to be thoroughly briefed by the operating room nurse. The nurse will ask about their medical history, have a laboratory profile made, as well as checking all necessary vital signs. Once the patient is thoroughly prepared for surgery, it's then time for a short but scenic ride up to the operating room.
Our big job in the operating room is preparing all the necessary supplies and equipment for the actual procedure, and also to monitor the sterile environment in the operating room. The nurse is sort of like the sterility guard, you might say. Operating room has a lot of highs and lows. You can have your normal routine schedule, and of course we have to be ready at all times to take that trauma or that emergency that happens in the community. And it's stressful. You learn how to hop out of bed in a second and rush here and be ready to roll. One thing I think that really keeps me in here is you have a high degree of satisfaction. You actually complete the job. Instead of a patient being on the floor, for a week at a time or something, someone comes in, you fix them, you send them out, and you have a feeling of success that you've done a good job.